Hi, and thank you for joining us today for AAKP's Advocacy and Engagement Training Session on Making a Difference, Advocate to AAKP Ambassador. My name is Erin Kahle, and I am Director of Patient Insights, Data Analytics, and Advocacy for AAKP. I have the pleasure of overseeing AAKP's patient research and education activities, as well as our grassroots advocacy and engagement initiatives. In 2017, AAKP launched its Ambassador Initiative, which has continued to grow and expand across the U.S. and globally. AAKP ambassadors are our supercharged volunteers who are dedicated to elevating the kidney patient voice in all medical and national policy decisions, protecting the unique relationship between patients and their doctors, educating patients and their caregivers, and preserving patient choices as informed healthcare consumers. They are AAKP's boots on the ground, actively reaching those who may not have immediate access to education, support, and resources. AAKP ambassadors are determined to disrupt the status quo of kidney care. These individuals engage in efforts to improve care for not only themselves, but all individuals with kidney disease, and they work to ensure kidney patients have access to approved and available treatments, that they are equipped with the knowledge to make informed decisions, and that they are provided the opportunity to lend their voice in all aspects of their care, including in the research and development of new treatments, therapeutics, and devices. AAKP ambassadors are individuals with early stages of kidney disease, individuals on all forms of dialysis, kidney transplant recipients, family members, caregivers of kidney patients, and living kidney donors. At the end of this presentation, I'll share a link to our ambassador application if you are interested in becoming more engaged with the AAKP. I'd like to introduce two AAKP ambassadors and have them share why they became involved and what activities they have participated in as an ambassador. Damion Marshall is an AAKP ambassador out of Atlanta, Georgia, who has been incredibly active with us since attending his first national patient meeting in Washington, D.C. back in 2019. I'll turn it over to Damion to share a little about his connection to kidney disease.
My connection to kidney disease is real simple. I'm connected because I'm a patient. I became a patient and diagnosed with chronic kidney disease in March 2012. So far it's been about 10 years that I've been managing, and I like to say managing my kidney disease. I'm just really honored and happy that I was able to stabilize my situation because I have experienced individuals who have, progressed kidney diseases, progressed to stage 4, stage 5. And currently I'm stage 3B, and been stage 3B for quite some time. So through diet, exercise, taking my medications, I've been able to stabilize my situation. So I'm excited about that.
Why did you decide to become involved with AAKP?
I decided to become involved with AAKP, and it was actually the exact day was April the 19th in 2019. I can remember sitting at work. I was at my desk trying to figure out what can I do to better myself, better my treatment, and at the same time educate and advocate for others. Because like I said before, my situation is stable. My kidneys were stable. And at that time I was 7 years into it. And I told myself that I was doing something right. So if I'm able to stabilize my situation, and I've been at stage 3 for 7 years, what can I do to educate others in the hope that they can first get diagnosed, right? Complete a screening and identify if they are, or if they're diagnosed with chronic kidney disease or not. But if they are diagnosed with chronic kidney disease, what can they do to help manage their disease so it doesn't progress further? And so that's when I decided to research. I looked up plenty organizations, but I chose AAKP because their missions was just really just focused on the patient. So I wanted to be a part of an organization that allowed the patients to have a voice and allow us to be involved. Patient's voice, patient's choice.
What does it mean to you to have patients at the table to share insights and feedback on things like clinical trial development, policy and regulatory issues, medication and device development?
And so it is important to me that patients are involved. And what I like about AAKP, that they allow patients to be involved as much as they would like to. And having that representation is everything. People that either look like me, feel like me, talk some of the same language that I talk when it comes to chronic kidney disease, like creatinine. What does that mean? When I talk with people and may say the term creatinine, those who are not diagnosed with chronic kidney disease, again, it's difficult for them to connect when I explain that process. But when I talk to another patient and I say creatinine, they instantly connect. And you see the empathy and you feel the empathy. And so that empathy, as well as the sympathy, is what we need to represent what we're doing, what we're going through, and what we are becoming. And that's very, very important to me. And I'm sure it's important to other patients out there.
What activities have you participated in as an ambassador, and why do you think this is important for yourself and others impacted by kidney disease?
Yeah, it's funny. I have been a part of AAKP going on roughly 19, a few years now. And with that said, I have spoke at many um, company committees. I've presented at different, I would call them um, different national meetings. And so I had an opportunity to speak with Bear, the company Bear, where I presented a patient perspective internationally. Like there were people from different countries that was a part of that particular meeting. In addition to that, I also did some research. One particular research I was a part of is a clinical research involved in learning, or I would say it was a focus group to help understand the reduction of medication related to disparities. I've been a part of AAKP Renal Life magazine a number of times, in addition to being a part of AAKP mentoring project with Emory University. But those are just a few things that I've been a part of. And I don't want to forget Valtrex. I did two important engagements with them. One was with a pharmaceutical company with Valtrex, where they actually focus on the FSGS trial. And I sat on their advisory board as well. So those were some things that I was excited to be a part of. And it's important to me because it goes back to, patient's choice, patient's voice, or patient's voice, patient choice. You can use it interchangeably. At the end of the day, it's me making a choice and me having a voice to be able to speak to those partners, right? Those stakeholders, to let them know how do I feel about certain things, providing input to make sure they keep the patients at the forefront of whatever they're doing out there in their research.
What do you hope to accomplish as an AAKP ambassador to improve kidney care for yourself and others?
I hope to accomplish to live a fulfilling life, right? And so sometimes when we have a diagnosis, right, oftentimes we're looked at as a number, as data. And when we're interacting with stakeholders or pharmaceutical companies or some of the clinicians out there, they don't always keep in mind that we are patients, we have feelings, we have emotions, that we're dealing with mental health issues, we're dealing with spiritual challenges, as well as emotional struggles as we go through this journey. And so, with that said, I just encourage and I advocate individuals out there to really just step up, be you, and do all that you can do to live a meaningful, a purposeful, a fulfilling life. You just don't want to just get up and just walk around like a zombie and not have meaning and not have purpose. And going through certain treatment regimens, oftentimes you get weary, you get tired. Do I get tired of taking medication? Absolutely. However, when you put meaning and purpose behind your treatment, you then begin to live, in my opinion, a very meaningful, a purposeful life. And you continue to just really pour your knowledge and your education and your experiences out there into the world so that someone else can benefit and hopefully don't have to go through some of the challenges that you may go through. I don't want anyone to experience some of my challenges. And so if I can just touch one or educate someone so they can avoid or prevent certain things from happening that I experience, I think that would really decrease some of the stressors that we deal with. But at the same time, it would provide and instill more hope.
What would you say to someone who is newly diagnosed with kidney disease or new to dialysis or transplant and they want to get involved in advocacy?
For those who are newly diagnosed with chronic kidney disease or just started dialysis or have a transplant, my first thing will be to become your own advocate. At first, it's probably going to be a shock. You're going to go through various feelings and emotions. You're going to go through the several stages of the grieving process. Allow for you to go through those, right? Because one day you can be angry, one day you're bargaining with yourself, Lord, why am I going through this? Why me? Why me? But once you come out of, I like to call the anger or the victim mentality, we then have to switch gears and become a victor. So we have to go from being a victim to a victor. And when you become that victor, make sure you create your support system. Your support system should include doctors, dietitians, nurse practitioners, best friends, your pastors, your brothers, your sisters, and allow them to be a part of this journey. Share with them some of the things that you're going through. When you're not feeling well, when you're feeling sad, when you're feeling depressed, when you're tired. One of the things that I experience oftentimes every now and then is feeling lethargic. Matter of fact, I'm kind of coming out of it right now as we speak. And so you have to allow your time, your body, you have to allow time for your body to rest. You have to allow time for your mind to rest, because trying to work and trying to also maintain your health is just like 5 jobs. So with that said, you have to make sure you have people to lean on when those times emerge. So I say to you, create your support system, get up in the morning, tell yourself how much you love you, affirm you every day that you work up, even if you're feeling bad, just affirm who you are. That instills hope. You're teaching yourself, how to address adversity, how to address the challenges and the pain. And I guarantee you, once you get past those rough stages in your life, you will find yourself to be a very strong individual. And that's what we want. We want you to remain strong throughout this journey.
I'd now like to introduce Terry Litchfield, an AAKP ambassador in Wisconsin. Terry has a long history of advocating for kidney patients, starting many years ago, and I invite her to share how she got started.
My connection with kidney disease is as a spouse and a family member of a dialysis patient. And I connected on many levels. My husband was a long-term dialysis patient, and everybody knows that families are a very important part of kidney care, especially dialysis and other treatments for end-stage renal disease. And so I was a family member, a spouse, and have now become, after my husband died, a kidney patient advocate to help other patients find their voice and navigate the waters of kidney care.
Why did you decide to become involved with AAKP?
It began in 1979 when, right out of university, I worked for the National Kidney Foundation. And I did a master's thesis on rehabilitation in kidney patients on dialysis. What are the factors that influence success? And so in that master's preparation for the thesis, I interviewed long-term patients. In 1979, you were long-term if you'd been on dialysis 10 years. And one of the patients I interviewed was Bill Litchfield. And before he passed away, he was the U.S. longest survivor on kidney disease treatment, 46 years. He started dialysis in 1968. He did 21 years of home dialysis. And he was one of the original AAKP members when AAKP, after it started in New York, and he was from Texas. They advanced chapters, and he was one of the first members outside of the state of New York. In those days, it was called NAF, the National Association of Patients on Hemodialysis. And it was AAKP members who testified at Congress in 1971, including one of them dialyzing in the House Ways and Means hearing room, that advocated and sought and received the passage of H.R. 1, which was the coverage of kidney failure for any age as part of Medicare. My husband was one of those 4 patients at Congress that day. And so here we are, decades later. I'm still involved in the kidney world and spent a lot of time at kidney advocacy efforts. I have remained and been a member of AAKP since 1979. And so it's that involvement with AAKP that has really kept me connected in the kidney community. I still do a lot of work in the dialysis access field and look at regulatory things and still stay active in AAKP to continue the work my husband started in 1968.
What does it mean to you to have patients at the table to share insights and feedback on things like clinical trial development, policy and regulatory issues, medication and device development?
Well, I have to say one of my favorite programs of AAKP is Advocacy Capitol Hill Days. It's one thing to bring doctors to Congress to tell of the issues, but an altogether different dimension when you have a patient. And I tell you, we join with the Renal Physicians Association and visit key congressmen and women with a focused agenda. And in the past few years, we've been very, very successful. One of the things that I'm proudest of, AAKP led the efforts to extend immune suppression drug coverage for kidney transplant patients beyond the 36 months. The previous rules only paid for transplant medications that prevent rejection for 36 months, 3 years. So in essence, that kidney transplant had a time limit on it. Other organs had unlimited coverage, and we were successful 2 years ago to get unlimited lifetime coverage of a transplanted kidney. Patient engagement is really the super medicine of this decade. And it's really important that patients and family members engage to see the impact of new products, new regulatory rules, and how it will affect them and their kidney disease. I was very happy to see when the FDA made a formal policy about engaging patients in device trials. It's very important, and my motto is no research about us without us. So when we visit either congressmen or those at Medicare, or even in talking with device companies, it's really important. And I've seen just a paradigm shift over the last 5 years, listening to patients along with doctors. It's really important that patients step up and share our voices.
What activities have you participated in as an ambassador, and why is it important for patients and caregivers to be able to talk to Congress?
Well, I think if you name an AAKP program, I've probably participated in it. I do the Hill Days, both virtual and in person. And then they have a wonderful webinar series. And I've been a speaker and a moderator on several of them about taking care of your kidney disease, taking care of your vascular access. And I've participated in the annual meeting multiple times. And I often am representative of the family, and particularly spousal concerns and issues related to home dialysis. Because again, kidney disease is a family disease. And especially when we talk about home dialysis, that affects home dynamics. Making sure your house is clean and equipment is ready and you've got ample place to store it. But those are just a few of the things I've done through the years, and then have supported AAKP through membership and donations.
What do you hope to accomplish as an AAKP ambassador to improve kidney care for others?
As an ambassador, I am honored to help AAKP advance causes, either through legislative advocacy or direct to patients. So things like Hill visits, or even visiting CMS, the Medicare offices, about payment rates that need to be reviewed, and how things that changes by governmental agencies make, how they might impact a patient. Another good example, in the early days of COVID, patients heard the doctors and nurses talking about COVID, but nobody was talking to patients. It's really important to remember that the first 2 COVID deaths in America were 2 dialysis patients out of Seattle, Washington. And so AAKP was besieged by requests from patients and family members, what do we do about this COVID? And so very quickly, AAKP bridged that educational gap, and they offered, first of all, they did a flash survey and confirmed that patients knew about COVID, but they weren't hearing about it from their dialysis providers and nurses. And so they quickly put together some webinars, and I was on the panel for the webinar on taking care of your vascular access during COVID. But literally, these programs that are still available on the AAKP website reached tens of thousands of patients in more than 50 countries. And as always, with an AAKP educational offering, they were free to listen in and participate in. I also hope to share knowledge about new products, because new products and devices, now that the FDA has really developed a white paper about including kidney patients in any kidney devices, I engage with the companies to find out the perception and actually help them develop strategies to include patients, because we really believe that patients should be a participant and an active partner in their best treatment options. Dialysis vascular access has actually been my vocation through Lifeline and my avocation. So I really help to keep AAKP abreast of advancements in that area.
What would you say to someone who is newly diagnosed with kidney disease or new to dialysis or transplant and they want to get involved in advocacy?
Well, I'm going to quote my husband on this one, because he always said dialysis should never keep you from doing something you want to do, but it's the best darned excuse when you don't want to do something. He was a real believer of putting back in what he called the kidney well, that a dialysis patient takes from that well every day. And it's really important to put back in the well, or the well will go dry. Find your voice. Learn about your disease. Stick to your treatment regimen. Don't skip treatments, including the renal diet and taking your medications as instructed. Enjoy your family and other things you enjoy doing. I would also suggest that they start local. Healthcare is always local. With your advocacy efforts, reach out to your local representatives in Congress or in your state house. They always have a local office, or if you're in a rural community like I live in now, there is offices generally at the nearest bigger town. And introduce yourself and tell them what your platform is. Get active in AAKP, because their action alerts will let you know when you are needed. Become a voice for yourself and other patients. And be sure and let your dialysis unit and kidney doctor know what you're doing, because there are times that they would want to join in. And always remember, patient voice means patient choice.
Thank you, Terry and Damion, for spending time answering these questions and sharing with us about your experiences as AAKP ambassadors. You have both certainly been involved in many activities ranging from education to research to policy, and we appreciate you both being active in our social media campaigns. On behalf of AAKP, thank you for your contributions as AAKP ambassadors. We look forward to your continued engagement. I'd like to show a few images of our ambassadors in action, promoting our awareness campaigns, becoming a kidney voter, attending events, advocating on Capitol Hill and virtually, manning information tables at dialysis units, and more. If you are eager to get more involved in your care and help improve care for others like you, I encourage you to become an AAKP ambassador. You can apply today at the website shown on the screen. Your application will be reviewed, and we will reach out to you to learn more about your interests and why you wish to become an ambassador. We have an open enrollment application process, and we are looking for ambassadors in the locations listed on your screen, as well as all over. I look forward to hearing from you. Thank you again for joining us for this advocacy and engagement training session titled Making a Difference, Advocate to AAKP Ambassador. I hope you enjoyed this session and are motivated to become further engaged in your kidney care. Thank you.